The long-awaited Canadian dental care plan launched today.
To the dentist under this program, the first visit happened at 7:08 a.m. this morning in Newfoundland, and that a further 1,200 individuals have now visited the dentist as of the most recent information that I have, and that those claims have already been processed.
Under the first phase of the plan's rollout, 1.9 million seniors are eligible for care as of today. But as of this morning, only 6,500 dental care providers had signed up for the program, leaving many patients still waiting for care. Mark Holland is the Minister of Health. Minister, welcome back to the show.
Thanks so much for having me, David.
So you've launched the first phase of the Canadian dental care plan today. 1.9 million eligible seniors compared to 6,500 providers who have signed up at this point. How confident are you can get more providers to sign on?
Well, getting more confident by the second. We're now over 7,000, and that was so the latest number that I just got. In fact, just an hour ago, I can tell you that I got the number for the number of people who got service today. More than 3,500 Canadians got dental services today, many for the first time in their lives getting dental coverage. So this is a historic day as we launch dental care in this country. We've got work to do. It's the largest program ever in Canadian history, but an extraordinary day and great progress being made.
The last time we spoke, you had suggested you had found an alternate pathway for dental providers who don't want to sign up fully for the program, for their patients to be able to use it and do a one-off billing each time they go there. That seems to have been agreed to, but it doesn't come into effect until July. So what should people do between now and July who want dental care, need dental care, want this government support, but they have no way of accessing it?
Well, we're having really positive conversations with the dental associations. Look, we've really answered all of their questions. I don't think there are really very many outstanding issues left. So I think it's time, for us all to move forward here. We got to get services to people. And we have tremendous need. As you mentioned, close to 1.9 million Canadians signed up. And I'm hugely encouraged by the number of dentists. As I say, that number changing rapidly now, over 7,000 dentists participating. So I think there's a real opportunity between now and July 8th, when that alternative pathway comes on, to get tons of folks signed up. I think lots of dentists are seeing just how easy this is. The fact that 3,500 people got service today so far, that's only as of 3 p.m., tells me that this is working and working successfully, and really encourage everybody to participate. We have huge need out there. I know dentists and dental associations are with me on this. We have 9 million Canadians who don't have oral health care. This is an extraordinary opportunity for them to be able to get the care that they need and deserve.
On that, though, like the July 8th timeline, what is the biggest obstacle to have this ready, this alternate pathway? Because this is obviously something that once this comes into place, this direct billing thing, this will open the door to a lot more people. What are the big challenges to be cleared by then? And could you possibly have that date moved up and have this in place even earlier?
Yeah, I go back. One of the things the dental associations had as a concern was that the contract process was too onerous. So we kind of stripped that for parts. We took it from 27 pages down to 2 pages, really just mirroring other insurance companies' terms and conditions. And still the dental association said, no, they wanted an option to not even use that, to have something that they would interact with just on a one-off basis. So we agreed that's what the alternative pathway was, but we didn't expect that. So we have to technically build it out and make sure that it's going to function and be successful. And so in order to have that quality assurance, July 8th is the date. But one of the things that we're saying, and is working very well, is to say to dentists, look, if you're apprehensive, sign up on the existing portal with those 2 pages, the existing terms and conditions that you have with any other insurance plan. And then if you're at all apprehensive on July 8th, move out of that program and move to a claim-by-claim basis. So that really eliminates, I think, any concern or risk. And I'm quite confident that will help ameliorate the numbers in the coming days.
So, Minister, how do we square that with the fact that the head of the Canadian Dental Association, the newly elected head, Dr. Joel Antle, he's a Winnipeg dentist, he hasn't signed up for this because he wants to wait and see how it goes, and he feels it's still maybe a little bit too onerous and has some questions. So how do we square your optimism with the skepticism, the head of the association you're working with here?
Well, the head of the association, they're responsible to negotiate, and that's what they're doing. So they're trying to get as many changes as they can. But every time they've raised an issue, I've fixed it. I had an opportunity. It was a very positive conversation last night with Joel, where I went through all of their issues. As far as I'm concerned, we're addressing all of them. The only issue that we cannot and will not change is we're not going to have patients pay. To ask a vulnerable senior who, is maybe making $25,000 or $30,000 a year to upfront the cost of their dental care is unfair, and that is going to be a barrier to care, and that's the one thing we can't change. But everywhere else, I see agreement. Everywhere else, they've raised an issue, we've fixed it. So it's time now to move forward. It's time now for everybody to move forward with this plan, because we have these folks now, these seniors who are excited to get care. This is going to mean they don't wind up in a hospital room with an unnecessary surgery. This is going to mean they don't wind up necessarily with a chronic disease or illness as a result of not getting oral health care. And just frankly, the dignity of being able to have a smile that they're proud of.
So, Minister, another group that has a problem they're hoping you can fix are family doctors in Canada, especially ones who are incorporated, who are upset about the capital gains changes that are being implemented as part of this budget process, even though it's going to be its own piece of legislation. Various provincial medical associations, the Canadian Medical Association, are pushing back, saying this is going to cost the country doctors. You're the Minister of Health. I know you're not the Minister of Finance, but are you open to changing this if it is, in fact, the case that you could lose doctors over these tax changes?
Well, look, I am so appreciative of the doctors that we have in this country. They do extraordinary work every day, and they did extraordinary work through unbelievable, difficult times during COVID. We have to make sure that we're being fair to doctors, as well as to nurses and personal support care workers, and hygienists and physiotherapists and all of the people, dentists, everybody who works in our health workforce. And so one of the things we're saying is, over the last 5 years, people with the most assets, people who are in the top 1%, have made an enormous amount on their capital assets. When I'm talking to personal support workers, the last 5 years has been very tough on them. They haven't been seeing their net worth soaring. And so what we're saying is, on the first 50% of $250,000 a year,
Yep.
that you're going to get 50% tax-free.
That's not how it works, though, for an incorporated family practice, though, Minister, right? Because corporations pay it on the first dollar, right? No, corporations pay it on the first dollar.
But we're not changing, to be clear. The benefits of incorporation are not touched or changed. The changes we're making are to capital gains.
Right.
Capital
Understood.
gains mean that, so capital gains, to be very clear, your first, on $250,000, your first 50%, you don't pay tax. Okay. On the portion above $250,000 every year, you're going to pay tax on on 2/3. So we have 1/3 that's tax-free. That's still a huge benefit, and we're still keeping the tax benefits that are associated with with incorporation. We're not touching those at all. So these are big tax advantages, and I think they're fair. But we also have to be fair to the investments we need to make across the health system to make sure that we're there as well for nurses, as well for personal support workers. We have an important commitment on personal support workers to make sure that their wages are fair, and I'm looking forward to those conversations with the provinces. This is about making sure, as we've seen those really large capital gains over the last number of years that the wealthiest have enjoyed, that they pay a little bit more, so that we can end up having a society that's fairer for everybody.
Okay, I understand the way it works for individuals, but the doctors we've spoken with and the medical associations say if you set up as a corporation and you're using that to save for your retirement, which is what many of these doctors did after negotiations with provincial governments allowed them to do that, they say this is going to hurt their retirement planning as a result of these changes. I appreciate your argument that you need to be fair, but taxing these doctors differently doesn't improve the personal care workers' lot necessarily, or the nurses' lot, but it makes their situation worse. So it sounds like you're not willing to reconsider, though, despite the pushback from the medical associations. Am I understanding that correctly?
Well, I think there's some really important questions around doctors' salaries, and those are negotiated and settled at a provincial level. I think here we're talking, so if you're talking about somebody's retirement, incorporations, we're not changing the rules on incorporation at all. This is about capital gains. So to be clear, in this instance, you're talking about continuing for the first $250,000 in capital gains. So that's capital gains are profit. They're after expenses are accounted for. Your first 50% are not taxed, right? You get to be tax-free. That's an extraordinary benefit. That's continuing. Then after $250,000 in annual income through capital gains, now you're talking about being taxed on 2/3. So you still get 1/3 that's tax-free. That's a lot more generous than most countries. It is very competitive. And I think that given how much capital has increased, how much money folks have made through various capital investments over the last 5 years, relative to, for other folks, like I mentioned, nurses or personal support workers, haven't seen those gains in their net worth. They haven't had those kind of opportunities. So we're asking for just a little bit more so that we can make things overall more fair. And that's never easy. I understand that. But in government, you have choices. We have to make these investments in healthcare. We need to have dental care. We need to make sure that people have access to the medicine that they need. I know doctors care about that as much as I do. And so we have to look at the ways across the system, because of course this applies to all capital gains.
Okay.
And if you're in a couple, then that's each. So if you're selling a property, as an example, it's actually $500,000 a year that you're exempt for. So this is across the board, asking those who've done extremely well over the last number of years, who've seen huge increases in their valuations of their assets, to share a little bit of that so that we can make things more fair for everybody.
Okay, the doctors who incorporate those say it works differently as they pull their assets out of their corporation. They're taxed as a corporation, not as individuals, so those exemptions wouldn't apply. But I need to move on because I quickly just want to get one quick question in. It's on a big topic. British Columbia has asked your government to reconsider the decriminalization policies they've implemented, at least in public spaces. Your government is looking at it and thinking about it. What do you need to hear and see from British Columbia before you can say yes or no, and where do you think that's going to go?
Well, we have to be driven by data here. I am so ripped apart by the stories when I talk to mothers who've lost, and fathers and other family members who've lost loved ones. It is absolutely devastating. And we have to meet it with evidence. And there's a lot of people who are peddling solutions, frankly, the conservatives, who are peddling solutions that have been tried in other jurisdictions and completely failed.
Well,
so
what do you need to see from BC? Well, because I'm getting tight on time.
We're tight on time. It's all about the evidence. BC is sharing with us their plan. They're sharing with us exactly how this is going to work, exactly how it's going to help. And that's how we're going to be evaluating it, making sure we're staying close to data and science. You can't just act in a reactionary way and just do something to pretend you're doing something. You have to make sure that what you're doing is actually going to help people and save lives. And if you take time and talk to people who are on the front lines of this terrible, terrible epidemic that is killing so many people, they're really urging us to make sure that we make decisions that are rooted in evidence, not emotion, and that's what we're doing, working with BC.
Okay, Health Minister Mark Holland, thank you for your time today, sir.
Thanks so much.